Hello everyone, welcome to our wellness series by APSWC. And today our series is Wellness for the Seniors. Our first episode today is Wellness Care for the Senior and Geriatric by Christina Huang, who is residing in Kota Kinabalu, Sabah. Christina is the founder of Sunday Pro Nails. And I know Christina for almost 20 years now. She started as a nail technician, a business owner, and ventured into education. She graduated in 2017 in Bachelor of Science in Podology, and it's from the International University of the Health Sciences in Canada. Thereafter, Food Inc. started, and she is now a food care specialist, and I always call her my food doctor. So what is actually podologist? It's something really new to me when she went over to Canada to get herself certified. A podologist is someone who has advanced knowledge in lower limb diseases and disorders, as well as gait analysis and advanced pedicuring skills. They specialize in pedicuring geriatric, diabetic, and immune-compromised clients. The lack of standardization in pedicuring services in salons and spas means clients who are diabetic, suffer with ingrown toenails, skin or nail infections, or even structural disorders may not be getting the proper care they require. Podologists must complete a specific curriculum in order to learn how to care for their clients with special food care needs in a safe and effective manner. And today we are very lucky that Christina is sparing her time with us to explain to us how we can care for these seniors around us, and how, as spa specialists, we are able to take care of clients coming to the spa, and in fact, even at home as well. So over to you, Christina. Thank you so much.
Hello, everyone. My name is Christina. I'll be sharing with you the wellness care for the seniors and geriatric clients. So once we think about seniors, they are 65 years and above, right? So they are older, and sometimes when factories in our body start to break down, so is their feet. Okay, so it's very, very important that we take care of our feet so that it can bring us throughout the world and enjoy the world within. Okay, so let's start now with the statistics. What I'm going to share about statistics in Malaysia. So the Malaysia population, if you can see at the chart, 2022, okay? So this chart, if you see the green line, it's going to go up. So this is Malaysian population is going to go up. So during the 1960s until forever, okay? Until we die. But the thing is, it's always going to be a growth. So the geriatrics or the seniors are going to get older when this green line climbs. So the Malaysian growth rate, if you can see the other side, it's going down. So that means we're getting less and less children. So those who are here now, which is the baby boomers, or they are in their 70s already. So we are looking at a much, much bigger picture of older generations, which is coming to Malaysia, which is our Malaysian population is aging lah. So if you see statistics from 2014 until now, it's 6%. So today, this statistic is 2021, so it's 7.4. So that shows us that the statistics of older generations are getting more and more. This is going to climb higher and higher. Plus the babies, you can see that there isn't much more babies coming up in Malaysia. Okay, so we are in a senior stage. Okay, it will come to that stage. So we are looking at our demographic for the elderly. That is what we are going to service more in the future. Okay, so all right. So let's know a little bit about our feet. Okay, so our feet carry us around a lifetime, right? So it strikes the ground approximately every day. If you're a runner, more than 10,000 times a day. Okay, so for average, maybe 6,000. So averagely 10,000 times a day. If you walk throughout our lifetime, we can circle the world 4 times. So our feet really carry us around so much, and they absorb more than 600 metric tons of force. So that means when we carry our bags, when we carry things, when we carry our babies, so much force is being held on our feet. So actually 85% of the population already has foot or foot related problems. Okay, so let's know a little bit about the skin on our surface of our body and the feet. Of course, if you see the skin on the feet, actually it's much thicker. The stratus corneum, which is the outer layer of our skin, is actually thicker on the bottom of our foot. Another interesting thing about the foot is they don't produce oil, not like our skin at the surface. So our feet only produce sweat, only water. It won't absorb any oil. It only expels water. Okay, so that's why the skin on our feet is sometimes damp, but it's not. If the bottom of our feet is oily, it secretes oil, we're going to be slipping and sliding, right? So no, so our body is different. Skin on ourselves and the bottom of our foot and the palms of our hands is different. So let's see how we can take care of this. Okay, all right. So if you see this picture, I know it's very ugly, huh? Okay, all this is dry skin. So I'm trying to see all this, why this dry skin is causing so many problems. If you can see on the pictures, everything is dry. So that's why it creates problem. So when you want a very beautiful skin, we just have to take care of our feet so that we don't get germs or viruses or anything on our feet and cause more problems. So that's dry skin is one of the major things that we really cannot have on our skin to make it healthy. Okay, so how did this dry skin come about? Okay, dry skin actually, if you see here, is our lifestyle. Our lifestyle has been changed to very high fat, high carb, high everything, right? So this kind of lifestyle makes us have more metabolic problems. Okay, it causes diabetes. It causes us to become more obese. We have heart problems. Every other problems that we put into our body, the bad lifestyles, it will affect our skin. So what does this change into? Venous insufficiency. You can see all these lines where our venous system is starting to break down. Okay, when we're too heavy, when we're very unhealthy, our venous system will be breaking down. So when it breaks down, we have nothing, the metabolic waste in our body, there's no way to go. So it always pulls down to our feet. So that's why if you see any problems, the first thing that you see is, why does my feet swell? Okay, so this swelling causes poor micro circulation. Okay, so poor microcirculation means that when everything is stuck in our body, it makes us feel very, very bloated, very, very unhealthy, and then that will also block our sweat production. So when you can see it on our feet, the sweat doesn't produce, so it makes our the feet very, very dry. So that's the first sign that you can see. If someone has very dry feet, means that there's something wrong with their lifestyle. Okay, so it's the decreased dermal moisture that causes micro lesion. So micro lesion is when the skin already break down. Micro lesion is where a portal of entry for everything, for viruses, for bacteria, for you name it. It will cause so much thing. It's a entry to our body. So it's just like COVID, where you can get it from the mouth. This one is every day when we walk around, our feet will pick up things. Okay, so it's very important that we keep our feet very clean so that we don't have this dry skin. And when it breaks, it causes bacteria, fungus, so many other bad things will go in and then affect our body also. So this is the problem of dry skin. Okay,
Christina, if I can ask you, right?
Sure.
You know what you explained just now is very interesting, but does it mean that it only affects the obese people because due to weight, and then that's why our weight actually kind of give our feet some burden? And is it because of just weight, or is there anything else?
It's a breakdown of our cells, actually. It's a breakdown. Okay, when our lifestyle is very unhealthy, it will break down everything in our body, correct?
So it doesn't mean that when you're obese, then you will have you are more prone to these issues and this problem.
You are going to be more prone, especially so if when you're obese, your heart is not pumping as much also. Okay, and when you're in a sedentary lifestyle, that means you watch only YouTube and or watch TV and eat. So that is not a healthy lifestyle choice that one would normally
so it's more prone to people who are obese, actually having this problem. I would say that.
I would say anyone who has dry feet.
Everyone who has dry feet.
Yeah.
Okay, I do have dry feet when I get older. I think last time I remember when I was 18 years old, and when now I'm 48, right? It's totally different. My feet looks different as well.
Right. Okay. So that kind of that there's something going on when you don't really take care of your feet, then it's actually more importantly, you don't want any foreign body to enter your body through your feet. Okay. Yeah.
Okay. Thank you.
Okay, so moving on, I'm going to tell you more about what elderly's issues, what are their more pressing issues that will affect them. Okay, when you see a senior client, okay, they might have all this. If they are 65 and above, some or most, or if they get older, they will have one or more of this how to say
problems or issues?
No, issues lah. But okay, let's start again. You cut this away. Okay.
Right.
So the seniors will have some or more of these issues. Okay. So let us identify some of the issues that are happening on a senior client, which is 65 or older. So when you are doing their wellness, when they are on their wellness journey, of course, these issues are some of the problems that you have to be alert of. Okay, and then you change your own adaptation or your massage techniques to them, right? So most of these symptoms or issues, you can see them physically, but sometimes you really need to touch them in order to know what are the symptoms or issues that they're having. Okay, so circulatory system, which is their venous system, neuropathy, skin and nail changes, structural changes and deformities, and also other senior concerns is it's very, very not uncommon for seniors to experience problems due to normal wear and tear on their feet lah. So that means 65 and above, there are going to be more wear and tear. Okay, so in addition, the numbers of people with chronic disease for 65 and above, type 2 diabetes, thyroid conditions, cancer if they have cancer before. Okay, so all these are increasing in the age group of 65 and above lah. So all the more reason these clients actually need to special attention and understanding in order to modify their wellness care and treatments. Okay, all right. Okay, let's go through circulatory issues. What would you see in a older client? Okay, the first stop is chronic venous insufficiency, CVI. We always see this CVI in our client cards. Okay, what we do is when we see a new client, we will always ask them to fill in a card. Okay, see if we do assessments. Okay, and see what do they have on their feet before we proceed to our services. So the most common is spider veins. Number one is spider veins. Okay, you would see, wow, this is all physical. You can see it from the outside. You can see it with your eyes. Okay, which is distended capillaries that is what is called spider veins lah. Varicose veins, it goes deeper or fatter. The veins, you can see that it's bigger and more green or more darker in color. Okay, foot and ankle edema, when you touch them, you can actually feel that if it's they have swelling on their feet or not. And then another thing is the lack of hair growth. Okay, another thing of lack of hair growth means that they might have diabetic. They are diabetic. Okay, or when it's discolored and shiny looking, these are all the signs that you have to really look out for. So another thing is peripheral vascular disease. So this one is more due to their circulatory. They already have this disease for a very, very long time. So this one, you can see that their skin is all dark, or half of their legs is dark. Okay, and then sometimes they have sores. So all these sores, yeah, if you're not very careful with this, you can actually break the sores, and then bacteria, viruses can go into, and it is a very long process. Sometimes it needs when it gets very, very infected, they might lose their feet. Okay, they might get amputated. Okay, due to the circulation, the blood circulation is very, very poor. Okay, so all right. Okay, another thing is neuropathy. So neuropathy, peripheral neuropathy, is the endings of their nerves is already dying. Okay, so actually they can feel pain, and later stage, it might go numb. When you touch their feet, they cannot feel you touching their feet. Okay, so this is a very severe type of nerve ending dying. So it's called neuropathy. So it happens on type 2 diabetics when they are not under control. Okay, when they don't eat their medicine. Okay, or with diabetic also, there's a lot more complications to that. So neuropathy, at first it might be tingling, it might be burning, and then to numbness. Okay, so it's a loss of sensation. So they cannot feel heat, they cannot feel cold. So it's very dangerous for them. If you put them their feet in hot water, it might burn them. It might burn them. Okay, so that is a very serious condition that they have. Like, it doesn't mean that they cannot walk. They can still walk. Okay, they can still walk, but the thing is, when you touch their feet, no sensation. When you press, when you try and do reflexology and then they don't feel nothing. Okay,
Oh, really?
so that's scary. Okay,
Right.
so when
It
you
is
press so hard
scary.
and then they have no
feeling.
feeling, no expression, that's when you know that maybe you have to ask. Okay.
No, but I think a lot of clients like it really, really hard when you
Yeah,
do
but at least
reflexology.
you could feel that. But for these people, they can't. Okay, they don't have that. The nerve endings is already died, so they don't have that sensation at all. So,
Right.
okay, all right. Okay, some of the skin and nail changes. Okay, when you do a massage on them, you might see the skin. Their skin is really thin, or the nail is maybe very thick, and if the nails are thick, guaranteed it's got fungus. Okay, so fungus can spread. Fungus can infect another person. So just be very, very careful with people who has fungal. But it's a very, very common thing in Asia, because we don't usually wear footwear in the house, or we just go kaki ayam everywhere. So we will pick up things on our feet, okay? But luckily, we are a race that always shower. that is a very encouraging thing. But for seniors, how many times do they really take a shower? Only once in 2 days, or sometimes in I've seen maybe in stroke patients, they are, maybe they get a bath once a week.
Huh? Are you sure?
They do the wipe
Once
down.
a week?
Wipe
Twice?
down.
Once in 2 days?
They don't really shower at all.
Oh, wow.
Okay? Yeah. So
Okay.
their skin is really fragile. You could say that's fragile. So it's not very good for them to have too much shower, because of their dry skin also.
When you see people who have very thin skin, right? Because when I was a spa manager,
you cannot handle blood, you have to stop at that moment. Yeah, blood pathogen is nothing. It's very scary also. Blood can transmit a lot of things. So,
okay.
Yeah.
So does it mean that but when the client comes to you, right, their skin are very thin, but it's not bleeding, right? So can you still perform reflexology on them? Or maybe don't say reflexology, maybe just a very relaxing foot massage.
Just give them a very light wash, very light, or just a cream cleanser. Cream cleanser, not even a wash, it's a cream cleanser. I wipe them down, and then with that cream cleanser, I would slowly massage them, which is, my massage is like so soft, so gentle. It might be very, very gentle.
But you say they have no sensation, so even
if they have no sensation, but it's good that our hands touch them, they would know. Okay. So, but it's that caring for them, that they can see from their eyes where you touch them. It's very soothing for them. It's good for the soul.
Right. So, but we need to practice caution as well as therapy.
Very, very cautious.
To wear gloves.
Right. Okay. All right. So, skin and nail changes. So, due to metabolic and circulatory issues, so the thin skin, as you said, right, becomes very fragile, leaving it for more injuries. Okay, so these are some of the things that I always see in my clinic, that they have issues on their feet already. No one, or they can only go to the doctors to have it checked, but nothing can be done on them. So I am another person that they can come to, so that I can really take care of their feet, okay, make them feel better. But this is what this is my dream of doing feet. I know I'm a foot fetish kind of thing, but the thing is, I really do love feet. Okay, I love how I can transform my feet. Okay, only when you know how. Okay, then you can do it. But all these kind of issues which I see in my clinic all the time. So if you are not comfortable with what you're doing, I don't think it's a very good idea for you to start on them. Okay?
I know how
All right.
passionate you are when you see a pair of feet, Christina. Yeah, I totally agree with you. Not for everybody.
So it all starts from this dry skin. So if we can prevent this dry skin from happening, actually there's nothing much. They can go to spa. They can go everywhere. So if I can manage their dry skin for them, they can go to you, right? So actually, in this podiatry, we don't really have someone here. So I am a sort of like a technician that takes care of all these people's dry skin, okay? To make them better. Okay. Another issue, which is structural changes.
Sorry, Christina, if I might ask, right?
Yeah.
If let's say, right, I know there's not many podologists around, correct? Is there anything that we as family members can do for our seniors?
Sure, you can. Plenty.
Yeah,
plenty.
there are things that they can do to actually prevent them from having very dry skin. Right.
Yes.
And you're going to tell us more about that later.
Yes, I'm going to tell you more about at the end of it.
Okay.
So let me explain more about
Right.
how the structural other structural changes in elderly are bunions. If you can see, I've seen the middle picture when the toe already curled in. Okay, they're really like that. I have a few clients like this in KK also. So, and then another one is can't be helped, but we're managing sort of like her feet. We can make her more comfortable. It can be because how they stand, how they put their feet on the ground, and then if they have some diseases, it can change how their foot looks. Okay.
You mean that they are not deformed at birth?
No.
When they age,
it became like that.
Oh wow.
It became like that. Okay. Because of some disease that they have. Okay. Right. Some are because of in the middle picture is because one is hereditary. Sometimes their mother has it or their father has it, and then it's passed down. They're prone to this sort of feet. Then they might get it in. No, not really. Can, but the thing about Malaysia is 40-50 years ago, what kind of footwear do we have? Slipper, right? Slippers.
Yeah,
and then or shoes that is so tight and ill-fitting that changes the bone structure of when we're growing up. It changes when we're in improper shoes, improper. Okay, so it's being squeezed into this shoe. Okay, when we don't have enough money, or actually when you have also, there's nowhere to buy better shoes in Malaysia during that time.
Because everybody wants to look good as well in the 5 inches.
Yeah.
So
but it starts from young. See, when they are in kids really need proper shoes. So if they're always in slipper, when they're older, of course they're going to have bone deformities also. Okay.
Right.
So yeah. So proper shoes are very, very important. Okay. I know we're how much more time do we have? Okay, so other serious concerns. Okay. Another thing about seniors, they have poor eyesight, right? When their eyesight is poor, they cannot see how they're cutting their nails, and they cannot see how their feet changed. So all this is important for their family members to really take care of them, or to see or tell them, okay, what or help them with their cutting their nails or anything. So they need to check the bottom of their feet also. Okay, if they have family members, regularly check their feet, or if they're living alone, they have to have a mirror on the floor to check themselves. Okay, so medication is also another thing. Medication, sometimes older people forget to take their medicine. Okay, so they really need some care. So, and another thing is proper shoes, so to prevent injuries and to protect their feet and nails also lah. Okay, the end is, as what Alyssa have asked me just now, what are the things that we can do for them? Okay, for seniors to take care of their feet is, when you see them, you have to perform a skin and nail assessment for them. Check for injury, discoloration, or if there's any wounds. If you find any of that and you're not comfortable with proceeding, stop at where you are. Okay, all right. If they are okay, you can soak tepid water for 5 minutes only, not 10 minutes, only 5. Their skin is so thin that they really can only stand for 5 minutes of soaking in the water.
Oh, really?
Just
because it
5
will,
minutes. It will
because
break
the
down
skin
more.
it will break
Soften
down.
more. It will
They
soften
become
more.
soggy and
Yes.
oh
So
dear.
5 minutes is the maximum you can give them, okay? And not hot water. I would go towards maybe a bit more colder water. Not just warm enough, but it's not hot at all. Okay,
Right.
all right. Then you can do a scrub. So gentle scrubbing motion, and no harsh sugar scrub. What I say is sugar means if they are diabetic, if they you see in their cards that they are diabetic, why would you want to introduce more sugar to them? Okay, so no sugar scrubs on any seniors. Okay, they might have a little bit, but it's really sugar scrubs are really bad for them, for their skin.
Sugar, salt as well, because it's coarse.
Salt is coarse, yeah. Yes.
But coarse,
but I don't mind a bit of salt, so that,
but not to scrub.
No, not to scrub.
But not to scrub.
Yes.
Right. Okay.
No sugar scrubs.
So
that's more important.
No sugar, no salt scrub, but salt can be placed in because it has a bit of
antibacterial properties.
Inflammatory, yes. Okay.
Right. Okay. Right. So, and then if you need to cut and file their nails, cut them and file gently. Okay. No cuticle cutting. You cannot cut their cuticles at all. None. Okay, you can use a
really this one is something new
because it has an entry. So because the feet is always near to the ground, you don't want to open up something and let other bacteria go in. So we would be very gentle with them. Okay, so cuticle cutting is off. And so is the foot file thing, but foot file can very gentle, but no cutting at all. Only the nails you can cut. All right. Okay. And then number 5 would be clean and dry their nails. Use a cotton bud and dry everything in between their toes, especially. Okay, in between their toes. So, and then massage. Very important. Massage away from the heart, not towards the heart. Okay, away from the heart. Okay, so that if you dislodge, if you see spider veins, or they always has plaques, okay, that can give them stroke.
Oh wow.
Yes. Yeah. If you see spider veins or what we call
varicose veins, like it's very
sluggish veins that is really breaking down. You can see they're bulging already.
All right.
I wouldn't touch that at all. So I would just slide my hand over and slowly massage away. You don't want to push it up so that you dislodge it and then it travels to the heart or the brain. Right. It will give them stroke. Okay. Very important. Away from the heart, knee to feet.
Knee to
Okay,
feet. Okay.
knee to feet. Okay, away from it,
Mhm.
away from the heart. Okay,
Right.
you don't want to overexcite them also, right? When you do massage, it's a stimulant also. So if you massage too aggressively, it's too stimulating for them. Okay, their heart cannot take it sometimes. So just be careful of some of the things that you do towards a senior. Okay, so that's it. That's it for my presentation. So,
Wow, thank you. That's such a great information over there. Do you know what, Christina? I always think that you're the best in town. Okay, because
I'm the only one in town.
yeah, because the thing is, if you go for pedicure and manicure, right? They'll just beautify your feet, and you can have bling blings on your nails.
Right.
But to have somebody who really takes care, and especially to people who have problems in their feet, right? I think you're the only one in town. I'm not too sure whether podologist is not popular. I'm not too sure around the world or in Asia Pacific.
Right. It's not a popular subject.
But in Malaysia as well, I think there's not many. I remember you told me once that you take calls that, West Malaysian, there are a lot that you actually flew over there just to do special cases, right? Yeah. Okay, but I think we need that. Just thinking about it, having two senior at home, my parents, I'm thinking, okay, they're 65. Now I'm trying to think about how their feet looks like. And yeah, you're right. Their skin tends to be thinner. And yeah, you can see varicose vein starts, and you can see it bulging up, right? I remember once when I was very little, I see my grandma's feet having very thick nails.
Calluses.
Thick nails. And she always liked to, take things out from the nails, but the nails grow thicker and thicker, right? Which means that she has fungal infection.
Correct.
I think because she likes to go to this salon to wash hair, and they also have people who paint nails, right? And then I know how fast fungal infection can travel.
Can spread, yes. It spreads
right?
really quickly when your immune system is really down. So as a senior, they have really low immunity, they will pick up things very fast. So it's very important that they keep their feet off the ground with proper shoes, proper moisturizing techniques, right? So to keep their feet really moisturized.
Which means that actually it's a good thing that we should practice wearing slippers at home. We should practice wearing socks at home, especially for the elderly.
Not really socks, because if you wear socks, it's too slippery, they might slip.
What about socks with slipper?
I would just recommend a very solid slipper.
Okay.
Indoor slipper that is non-slip for them to wear in the house.
Right.
So that their feet is being protected from anything, from maybe a piece of glass that is there, or something sharp they can't really see, and then they will step on it.
Right. Okay. But what you said just now, not about the senior, right? Even about babies and about teenager and smaller kids, when they are growing up, they should have proper shoes, right?
Yes.
And less of slippers. Okay, I'm guilty. I'm a guilty mom. I think my children wear a lot of slippers, right? Because they love it. They just feel like they don't like it, like with socks and with sneakers, right? But you say it's bad.
Yes.
Why is it bad? Because the feet
it's not properly supported. I would say it's not properly supported that it can make them run properly. If with slippers they can't really run properly, I would just no slipper for kids. I think sometimes if you give them so if you want them to be in sports, make sure that they're in good and proper shoes. That will be better. To prevent injuries also lah. Okay.
That would be probably a different topic altogether, right? I think we're going to have also, maybe next time we should be talking about caring for feet for the children, right? I'm
Yes.
sure you do have a lot
A
children
lot.
friends coming to you as well,
Right.
right? But
Mhm.
particularly, I think a lot of seniors come to you, right?
Right.
Yeah.
Mostly seniors.
Right.
Yeah.
Okay. All right.
Until my oldest client is about 103. 103
Ah,
years old. Yeah.
103 years old?
Yes.
Oh, wow. Okay. So what we're going to do is we're going to share Christina's contact number and also email. If you have any question, you can ask her. But we can also take some now. If you have any questions, you can type into the chat box and Christina is going to answer you. Please click subscribe to our channel and you can watch over and over again. And this is not going to be our last wellness series. It's only the beginning. All right, so please stay tuned to APSWC YouTube channel and type in your questions to Christina, and I'm sure Christina is going to answer you. And otherwise, this is also our website, www.apswc.org. Please write to us if you have any question, or you can also write to Christina as well. Okay. All right. Thank you, Christina.
Thank you,
Thank
Lisa.
you so much for spending almost half an hour, right, to be with us today.
Okay.
All right. And
So I
it's
hope
really
everyone
insightful
learn.
sharing. Thank you so much.
Thank you. All right. Bye.
Please type in your chat. Type in into your chat. All right. For those who are here with us, Christina will answer your questions. All right. Bye, everyone.
All right. Bye.
Thank you, Christina.
Looking forward to seeing all your messages. Thank you.